The city of Hot Springs has always been known as a very giving community. There are many programs in place to help the public when they are in need, and some of us are sometimes just one paycheck or one personal disaster away from being in need ourselves. Today we're going to talk about a utility assistance program that is brand new for the city of Hot Springs, and with me is Lynn Blankenship, who is with the Cooperative Christian Ministries and Clinic.
Correct.
And also Randy Outler, who is the Director of Utility Billing Services for the City of Hot Springs. Welcome to you both.
Thank you
Morning.
for having us.
We're excited to launch a brand new program for the city that can help people in need. And as I said before, that could be any one of us, right?
Right.
Right. Randy, I think we'll start off with you and ask you to explain to us what is the new H2O program.
H2O Hot Springs is a program that's been designed to allow the public to donate funds which would be collected and distributed to persons of need that would be decisioned by our friends and partners at Cooperative Christian Medical Clinic. Like Terry said, anyone is possible to be at that threshold of needing assistance, and this fund and this program is designed to help those that have those specific needs for payment of their utility bills here in the Hot Springs area, for their Hot Springs utility bills.
Yes, and H2O is easy to remember because it stands for Help to Others. It was an idea that was originally proposed by Director Karen Garcia, who asked city staff to look into a program that would be easy for people to participate and help their neighbors in need. And Lynn, can you tell us a little bit about the clinic here, and overall, what do you do for the community?
Well, we definitely serve our neighbors in need. We have been in existence since 1997, originally as a charitable clinic that offers health care to people who live in low-income households and don't have access to health insurance and therefore the ability to pay for health care. Our world changed a bit with the implementation of the Affordable Care Act and Arkansas's expansion of Medicaid. That meant that the people that we were serving medically now have access to insurance. But our realization was that didn't solve their poverty issue, which is the ultimate issue. We had to look around at our community to find out if that truly was an issue in Hot Springs. And what we found was that Arkansas, by measure of median household income, is ranked the 50th of 51 states in average median household income. Now you're wondering why 51 states? They count Washington, D.C. as a state, which means if it weren't counted, we would be number 50. And with a low median income, everything in the household plays a larger part of that income. So if any one thing falls apart, suddenly there's a crisis in that household. We've been serving households that have crisis for about 4 years now and meeting that need. And when approached by the City of Hot Springs to help with this program, we immediately went in and assessed how many households we had been helping with their water bills. And we found that 26% of the money that we were paying out was going towards water. So we were very excited to be called on to help with this program. What that does for us is it allows that 26% to go to other needs in the community. And there's a great amount of need in our community.
And that's pretty amazing to many of us who did not realize that you were already serving 26% of the needs, as you say, were going to those water bills that are sometimes difficult to pay. Randy, tell us a little bit about how the program is funded. What does it depend on?
The program is 100% funded by donations from the public, which is very easily to be done. Donations can be made by several different ways, methods. The easiest is to go to our website at cityhs.net and go to the Utility Billing Services website and click on the H2O Hot Springs program, And from that, there's, I guess, a real good description on what the program is, how it works. There's a donation form to click on, fill that out, and send it to my department, Utility Billing Services, at 517 Airport Road, Suite C. And we will put that on their monthly utility bill and include that in that. And so when they pay that bill, including that donation, then that donation will be available for Lynn's team to disperse at their direction.
Now, if you are on bank draft to pay your water bill, how easy is that to set up?
It'll be the same exact process. It'll just be drafted from your bill versus sending in a check. You can also, if you'd like to come into our office, then you can bring your check in and you can make a donation there, whether it be a one-time or a several-time donation. Any way that you can imagine, we can accept those donations and apply those funds to the fund.
So you're saying that any amount at all
Any
is a
amount
help?
whatsoever, any amount. The donation form actually lists several dollar amounts as possibilities, but you can specify a specific amount if you so choose.
And it's helpful to know that if you can sustain the giving, great, but you're not obligated to do so. It can be one time or several times, correct?
Absolutely.
So it's sort of a one need fits all arrangement.
It is. It's easy to start and easy to stop. And we can stop that at any time that the donor so chooses. But we appreciate all of the donations that we receive.
Excellent. Lynn, how do you come into play? How does the clinic come into play in deciding how what people get assistance and how they get that assistance?
We have an assessment process through our case management department for anyone who comes in at a time of need, regardless of what that need is. When we determine that it's a water need, we actually ask different questions, have them fill out an application to meet the city's request. And part of that is we want them to put into that solution as some of the money as compared to what the city does. So instead of just paying all of their bill, we've determined that if they come up with 25%, a little bit of skin in the game, the city will provide 75%. We do look at the individual request and try to determine which families would benefit most in just bridging a gap. What our goal is to help individuals that come in that are not constant requests, but someone who just needs a little help and may actually be willing to continue on with case management to figure out how not to find themselves in that situation again.
And instead work themselves back into an independent state.
Exactly.
Wonderful.
That's our
And
goal.
there are safeguards built into the program, Randy, correct, so that someone isn't continually dipping into the fund, right?
That's correct. That's correct. I believe that one payment per 12-month period is what's allowed.
That's right.
And so.
But sometimes that can make a huge difference and a turning point in a person's life. Lynn, you were sharing with us earlier that you had a story of a person to whom it did make a big difference. Can you share that with us today?
Certainly. We did have a client that came in through our normal assessment process, met with one of our case managers, and had a story whereby she just needed a little help to bridge a gap. And we were able to meet that need. We continued to reach back to her to make sure that everything was going well. Fast forward a few months, and the case manager that helped her appeared at a restaurant. The person that had been helped greeted her at the table and introduced herself and reminded her how she knew her. And she said, "I want you to know that you and your help made a difference in why I'm still here today. Our household is doing well. My children are with me. They're in school, and everybody's thriving. And that would not have happened had you not helped me."
Isn't that wonderful? That it truly is making a difference in our community, and I know that the clinic does so in many different ways,
Mhm.
but this is a win-win for this public-private partnership, in that we're meeting needs, and you were already trying to meet those needs.
Right.
Now you have the city working with you to do so.
To make our ability to meet those needs that much greater.
Yes. Randy, let's back to the nuts and bolts here. How much do you need in your fund, so to speak, to start being able to help people?
Well, it would be, of course, all donations that we can receive would be wonderful. The more money that we can receive through donations, the more people that Lynn and her team can help through the instances that she just described. It would be wonderful if we could maintain sufficient funds in the account so that everyone that they deem as being appropriate for assistance could receive that assistance. Funds are limited, then that equates to a limited number of people that can receive that assistance. I would ask that everyone evaluate the program and give as they can to it, because it is a very worthwhile program.
But you do need to maintain a certain balance in order to be able to help other families.
We would like to keep on hand at least a couple $1,000s
Okay,
at all times.
very good. So if people have questions about the program, how can they contact you?
They can call my direct line, and that's, of course, here in Hot Springs, 501-321-6909. And I would be thrilled to talk to them about it.
And let's talk about the city website too, where there's a lot of information on the H2O program. How can you get to that page?
Okay. If they'll go to cityhs.net and go to Utility Billing Services, and then click on the H2O Hot Springs program, then there's a lot of information there, as well as some attachments that they can click on to receive the donation form and the questions and answers. There's several questions and answers on a page that they can look at for specific questions that we feel like might be pertinent.
Right. Lynn, as we wrap up, are there any other comments that you'd like to share?
I think that the one comment that I would like to share, which I've already said, is that we are just honored to be a partner in this, proud to be part of a community where not only the community is charitable, but also the municipal leadership in the community. It's just an honor to be involved, and we hope that we can really make a difference in some lives.
That is something that we all share, and thank you for bringing that up, that we're servants of the community, both the City of Hot Springs, its staff, as well as the clinic. Our mission is to help people in need and to meet their needs by providing services. When we team together, we can do a better job at that. If you have any questions at all about the H2O program, as Randy said, you can contact the City of Hot Springs. We'd be glad to help you. This applies both to people who are in need and those who are considering giving to the program. We're all blessed to be in such a giving community as Hot Springs is, and we know that many of you that are listening to this program today might help us spread the word. Next week, we'll bring you more city news.